Today I am going to tell you a story of Rohan. Rohan is a dynamic, intelligent person in his mid 20s. One day, he thought to pay visit to his grandfather who was terminally ill and hospitalized. So, he decided to go to the hospital. However, his friends and some of his elders cautioned him that it is not a good decision to go to a hospital in this COVID-19 situation. Rohan loves his grandfather. He has several memories and he also wants to discuss his success in the school because he became first in the school. So Rohan went and visited his grandfather. He talked with his grandfather for hours. They shared their memories. Rohan in fact bring his grandfather favorite hazelnut chocolate. He was feeling good. And then he went home. After 3-4 days, Rohan becomes ill. He has got slight fever. He was having a running nose. His temperature is roughly around 100 degrees Fahrenheit. He was kind of worried. However, after few days he developed a symptom, that is his eyes become puffy and swollen. Ouch, that hurts. Now a weird kind of thoughts is coming to Rohan's mind. He was thinking that whether his condition or his eye condition is due to the black fungus because it is recently in news, or is it something else. He was now start questioning his decision to go to pay a visit to the hospital. Is it he did a wrong thing? So he is having no clue. He is confused. As Rohan is an intelligent person, so he immediately went to a doctor and specifically an eye specialist. He told his story to the doctor. The doctor examined his eyes and then he come to the conclusion that Rohan is suffering from conjunctivitis. Conjunctivitis is an eye disease which can be caused by several reasons. It can be caused by viruses, by bacteria, fungi, certain allergies to certain conditions like pollens or dust might cause conjunctivitis. The eye doctor gave some prescription medicines to Rohan and told that he should take rest and he will be okay in 3-4 days. Now, if you are wondering that why I am telling you this story, and if you are listening to this, then I welcome all of you to Mannan's e-learning program. And today I am going to talk about fungal infection in COVID Kal. If you do not know me, my name is Amin Mannan and I am a PhD in molecular biology and one of my research interests in fungal pathogenesis. The Kal is one of the epoch or the period which is defined in Indian scenario. So that's why I use this topic. Now let's look into what are these fungal infection. Is there any kind of relationship between the COVID or not? So this is my topic which I'm going to talk about. Fungal infections is COVID-19 situation. Let's take the case scenario of Rohan itself. If someone is having a eye pain or eye redness, blurred vision, excessive tearing or an eye discharge, then there is a possibility that particular person might be having conjunctivitis. Or according to the CDC, the Center for Disease Control and Prevention, a United States government independent organization, suggests that it could also might be a cause occur due to the black fungus as well. Now Some of you who are not very familiar with fungus and fungal infections, and whenever the name of the fungus comes, then I guess this picture might comes in your thoughts. This is a mushroom, and this basically grows in a decaying matter. It is also one of our favorite food item as well. If you look into the number of fungal species which are present on planet Earth, then according to 1990 classification, the number is 1.5 million. And out of the recent classification, this number has been reduced, but they are something around 120k, 120,000. Out of these fungus which are present, there are roughly 300 funguses or fungi in plural. They can cause infections in humans. Now, some of these fungus like histoplasma, rhizopus and mucor, they are present in the atmosphere or inside the environmental conditions. They might be present in our AC duct system. They might be present in some of the food items which if you are buying from a gray market or a farmer's market, there is a possibility some of these fruits or the vegetables might have these funguses. Like for example, aspergillus is one of the fungus which is appeared in the onions. There are certain fungi or fungus like for example candida species. These are present in our body and they live as a common cells in our body. Some fungi can enter into our body like aspergillus or cryptococcus or pneumocystis, and they cause infection like pneumocystis pneumonia can cause diseases similar to the pneumonia. Now, who are these persons who are basically affected by these fungal infections? Usually, the people who are a old age or peoples who are going through solid transplantation, or someone who is going for bone marrow transplantation, or someone who having a predisposing factors like cancer or diabetes, then they are vulnerable groups. Or in nutshell, I can say that those people who are immunocompromised, okay, or their immunity or neutropenic, immunocompromised or neutropenic, they are the vulnerable group. But what is most important point which I would like to tell you, that these fungal infection was present even before COVID-19. Yes, it has been found that some of these fungal infections like black fungus, green fungus, yellow fungus or white fungus is associated in COVID-19 and it has been in the news. But sometimes who are not too much into this fungal field or fungal diseases or pathogenesis, you will be surprised to know that in European countries, the fungal infection is the fourth blood-borne infections. It's the people who died due to fungal infections is much more combined deaths due to the malaria and tuberculosis. Yes, there are comorbidities, but if you look into the numbers, so it is not something new which come across. So the idea of this whole lecture is to give you an idea that what are these fungal infections? Is there any kind of relationship between them in the COVID-19 scenario or not? If we look into the outbreaks of the fungal infections, so according to the CDC, the infections caused by fungi are very uncommon. There are few reports if you look into one of the very famous report that is in Ireland which occurs, and that is due to Phytophthora species which basically wiped out all the potatoes in the Ireland, and it's causing huge economic losses. But they are very uncommon. Uh, the person, as I said, come in contact with these or from the environmental source. Let me give you an example. Like in bird droppings, specifically the pigeons, it might be infested with cryptococcus, and then it can come and infects the human body, but that too only when someone is immunocompromised. It can also occur or it can enter our body from the open air or from the prolonged stay in the hospital. That possibility is there. Now, whether Rohan acquired this infection of his conjunctivitis, is it from the hospital? We cannot be very sure about that. Or someone who acquired a black fungus disease from the hospital environment. Again, the studies is not very conclusive as per the latest data which is available. Now, if you look into the relationship between COVID-19 related fungal infections, is it is a causative agent, means that COVID-19 leads to a fungal infection, or fungal infections leads to a COVID-19, it's still not well established. We cannot say with certainty unless we evaluate more data. Is it coincidental? Yes, so far the reports suggest that it could be coincidental. Whether it is a contributing factor or not, again, we cannot be very certain about whether it is a contributing factor for this or not. However, which is very certain is that people who are having comorbidities, like for example diabetes or neutropenic or having an organ transplant, or their immunocompromised state is less, that is means they are immunocompromised, or the therapy which has been given, like the steroid therapies which is given to the COVID-19 patient, so it has been found that these particular patients can acquire these fungal infections or black fungus or white fungus. Black fungus is mostly we are associated with mucor or aspergillus, and the white fungus we usually associate them with the candida. It can come from the hospital and it can come from the home environment, because these fungus, as I said earlier, is around us. It can come in the food items or in the vegetables, or in fact if you in sometimes even in a home, if it due to prolonged incubation in the fridge, they might be infested with fungal infection. Fungal rotting can occur. Now, the idea of this whole topic, that whether these kinds of diseases is treatable or not. So yes, there are certain medicines like voriconazole, fluconazole, amphotericin B liposomal injections is available. The miconazole, which is usually given as a topological cream or in a surface based cream, can be given for this. So there are these drugs which is available into the market, and these are treatable. So people should not be panicked about this black fungus disease. They should be aware, and the purpose of this lecture is that people should be aware of this thing. They should keep their environment, the vicinity of their society to be clean. They should follow their own personal cleanliness regime. And as most of you are well aware that prevention is better than cure. So one should can prevent by simple techniques which I just said in this lecture. One more thing which I would like to tell you here is that is the vaccination can protects us from these diseases. So please don't be hesitate to take these vaccines. Because some people, especially in Asian countries, or someone who is not well read, they have this notion that vaccination, there are certain side effects which has been associated. I will go with the endorsement of the vaccination. And one more thing which I would like to tell you, because this is all about COVID-19 and fungal infection, is there are certain vaccines which is available for the fungal diseases. Can we use that vaccine? In market, it is not yet available, but yes, the certain clinical trials which is going on, like for example, this is NDA3 vaccine which is shown a protection in the mice model, and that is related with the Candida auris, which is in fact defined as a global pathogen by CDC. Our group has also, using an in silico approach, talk about that a epitope based vaccine can be used for Candida auris. So maybe from a timeline of 3 or 5 years, we might expect that there will be vaccines which will be available for fungal infections as well, so that one can prevent them. Friends, if you like this video, so I will tell you to